All right, we continue our in-depth look at a condition that affects hundreds of Hoosier babies each year and the journey that many families take so their children can love their forever smile.
WRTV's Cornelius Hocker introduces us to the healthcare workers who care for the children born with cleft lips and palates and shares the special bond they have with the babies.
It means a lot to me that, this isn't just a job to go to. This is something that is kind of soul level work.
That's how all of these women, Jody, Kara, Ellen, and Caitlin, feel about working at Riley Children's Hospital, more specifically with patients in the cleft and craniofacial anomaly program.
We love our patients, we care for our patients, and we really just want to make sure that every parent, every baby, every family member has what they need to be successful.
Near and dear to my heart, connecting with families, going through the same thing with my son. Just knowing that there's support available.
Each of them have a deeply personal story tying them to this work.
Luke is 10 and he has had 12 procedures so far.
Miles is 10 as well, and we've only had 3.
I only had 3 surgeries. My cleft was just a cleft of the cleft lip. A cleft lip only.
I was born with a cleft lip, a cleft palate, and craniosynostosis. So I had 16 procedures by the time I graduated high school.
These pictures, Jody with her son Luke, Kara with her son Miles, Ellen and Caitlin as a baby, show but a moment in time on all of their cleft journeys. So when anxious parents come in for appointments, this team says they provide them comfort, knowing there's someone who can relate to what they're going through and also providing hope for the future.
Parents can see us working in this environment and have like an adult who is a model of their child and what they'll grow up to be one day.
The Allgoods are just one of those families taken care of by the team at Riley. We told you about them last night. Their daughter, Emmeline, now getting to see her beauty reflected back at her through their dog, Maverick, who also has a cleft lip. Caitlin was the Riley team member who connected the dog breeder with the nonprofit Legendary Smiles to make the special adoption happen.
Why is it so important for people to see themselves represented, not just on the news, but like in animals and their pets and in everyday life?
I think representation matters. And it's important to see yourself reflected in the general community and to not feel like you are an anomaly or there's something wrong with you, because I think the more we normalize it, the less that people think badly or differently of it.
That was Cornelius Hocker reporting. To learn more about the Riley Hospital Cleft program, along with more resources available to cleft-affected families, just look for this story on WRTV.com and on social media.